Insertion of an intravenous catheter. For IV insertion, this includes the IV catheter, the IV tubing and bag, gauze, gloves, alcohol skim prep, tape, and other dressing material. Next, wash your hands. Then position your patient so they are comfortable and explain to them what you plan to do.
We're going to start an IV to give you extra IV fluids. Is that okay with you?
Put on your gloves. Apply a tourniquet to the arm proximal to where you intend to insert the IV. Examine the patient's arm to find an appropriate IV site. Choose a site where the vein is straight and prominent. Avoid sites over joints or proximal to bony prominences. Veins can be located both by looking and by feeling with your fingertips. Sometimes you can make the veins more prominent by having the patient make a fist or by lightly tapping on the vein. Next, clean the skin, overlying the site with an alcohol pad. Stretch the vein well distal to the insertion site with your non-dominant hand. This will stabilize the vein. Hold the catheter between the thumb and your second and third fingers with your dominant hand. Let the patient know you are about to place the IV.
And here we go. I'm going to go in here now, Ted.
Pierce the skin, advancing the needle forward steadily. When you see a flash of blood, lower the angle of insertion and continue to advance the needle for 5 millimeters. Then advance the catheter over the stationary needle to the hub. Remove the tourniquet and compress the vein with your finger just proximal to the catheter tip. Retract the needle. Connect the IV tubing to the catheter and open the IV. Push or retract the catheter slightly to optimize flow. Secure the IV with tape.
IV insertion is one of the most basic clinical skills, and it's one skill that can be utilized at almost every level because most health centers, district hospitals, and provincial hospitals have the capacity to give IV fluids to patients who need them if they know how to do it.
The challenges in teaching emergency clinical skills in Lao are considerable, but not insurmountable. Certainly you need co-trainers to run small groups who can supervise the students, make sure that they are learning techniques properly and that they get all their questions answered and their techniques corrected when they do things wrong.
Some of the biggest challenges to overcome are that the curriculum needs to be translated into Lao. It needs to be given in Lao to trainers who can then go out and train other people.